Hi, I'm Dr. Sebastian Gonzales. The topic of this video is IT band issues, which is the most common cause of lateral knee pain in runners. It's actually more common with distance runners than sprinters, and the reason they theorize is probably that the runners with slower paces have increased stance phase because it usually occurs during stance phase. I believe it's like 4 to 7% of runners will experience this. It's not really a hard condition to address. You have to know you're looking for the right thing. This mainly is an educational video. I want you guys to realize what areas or bony structures are around so you can palpate your own body and just kind of feel what you feel. Going in and having some good information before you go see a medical doctor or a sports chiropractor is a good idea to have. That way you can have an educated conversation about it. With IT band syndrome, we are looking mainly at this region back here. So lateral side of the knee. I'm going to have you actually flex and push me this way. So you're going to feel, if you do this, you're going to feel the lateral hamstring tendon. It's not this. Sometimes people think it is because this attaches down here as well. Relax for me. It's mainly if you were to find this point and just kind of start moving forward here, you'll find something that it's rather firm. And extend your leg for me. So as she extends, you can find it basically right here. It's going to feel like a ropey structure, and you can follow that down. It's going to attach to the lateral aspect of the knee down here. Now this band goes all the way up into the hip. It's not a very stretchy structure. It's rather firm, and I've heard from other people saying that actually if you dissected it out and hung it like in a meat locker and you hung a 50-pound weight on it, it wouldn't stretch at all. So a lot of people try to stretch this out, but realistically they're not doing anything too productive in regards to increasing length. So it's not a length issue a lot of times, it's an issue with the things attaching to it. So we have the glute max here, which attaches to the posterior aspect of it. You have the glute medius, which attaches in this range, the TFL, or the tensor fascia lata. These are all things that we should probably address and make sure that you have proper strength assessment on to make sure that these aren't issues with it. So on these people as well, you're going to find a lot of times internal femoral rotation. So here, it's very minimal, obviously I'm just exaggerating the point, and external tibial rotation, which is down here. This makes it so the lateral condyle of the femur puts it in a position where it mainly rubs on the IT band more, and that's why this is called a friction syndrome. Now this is generally recognized as a friction syndrome. It can happen as you're running on uneven roads. It can happen with increase in miles, not a proper increase in, well, you can't just jump miles like that. Poor shoes, I mean it can be a lot of things. But generally speaking, it is something you have to address isolated and then work with the strength and conditioning specialist or some type of trainer that knows what they're doing to be able to address the strength issues surrounding the entire thing. Majority of the time that I find that if that part is not addressed, the symptoms will continue to reoccur. This condition usually responds very well to conservative care such as myofascial release, massage, strengthening, stretching, things of that nature. Active release and grassing are good things that I like to do with it, but they're not the only options as well. There's many ways to skin a cat. So either way, you have to make sure that you remove the scar tissue from the area locally as well as take care of the strength and conditioning component. Thanks for watching. I hope you guys learned something. There's different videos on our website, that's p2sportscare.com, or you can check out our YouTube videos.
Don't forget to check out our ebook at the website below.